Meningitis causes an acute inflammation of the outer layers of the brain and the spinal cord. Its most common symptoms are fever, headache, and stiffness of the neck.
It affects all age groups. Interestingly, even newborns.
Findings show that Nigeria lies on the meningitis belt of sub-Saharan Africa, where outbreaks occur regularly. Overcrowding, lack of personal hygiene, and environmental sanitation are also contributory factors. The current outbreak, which was first reported in Zamfara in November last year, has since spread to Sokoto, Katsina, Niger, and the FCT, with death toll hovering around 300.
But once the number of herd immunity reaches a low level, there becomes a spike, an increase, and that is what we call the epidemic.
This outbreak is considered the worst since 2009, where over 300 lives were lost to the disease. There is fear that the disease could be out of control if refugee camps, prisons, police cells, and living quarters are affected as a result of crowding. Medical experts identify vaccination as an effective way of preventing meningitis.
Depending on the situation, pilgrims traveling to other countries where a large number of people will meet, we give them vaccination using a pentavalent antigen vaccine. But for the one in country, we use a reactive vaccination program against the particular strain that has been picked, which in this case is C, and we give them a bivalent antigen of A and C.
The way forward for us to curtail or to prevent this vaccine shortage is to critically and seriously about building local vaccine manufacturing capabilities so that we can overcome this. I don't think with the problem that we have now that the government should wait for donor agencies to come and donate vaccines for them. Take a proactive measures immediately to bring in these vaccines.
A large-scale vaccination program has begun in the affected states.
You don't hear about meningitis before?
No, I never hear.
I once experienced it in my village.
Why are you still staying here? No.
This is where I can only afford accommodation. I used to bring out my mat in the night, I sleep outside.
Apart from public health education on the importance of immunizing persons aged 0 to 29, experts include minimizing contacts with infected persons and case reporting on the part of the public as other measures to curtail the disease. Given the magnitude of the recent outbreak, relevant agencies are working together to coordinate response towards containment of the spread of the disease. Uche Nwizu, NTA News.